We're talking about the pelvis when it comes to labor and delivery. And the reason I want to talk about this primarily is because I got this fancy pelvis for Christmas.
It's very fancy. It's very, I like it. Did Santa bring you this?
No, my mom brought this for me. I know.
It's a good present.
Thanks, honey. Her name's Honey. So we talk about positions that you can get into during early labor because we want to open this top opening right here. We want it to be kind of open, right? And then we talk about positions for pushing because we want this opening here to be more open. So, side note, your pelvis does not move this much. This is a teaching tool.
I think that you made that point on one of the posts this week. I think that was a really good point.
Yeah. It should not be this movie.
So when you see stuff on Instagram, like it's not.
Yeah, like you're not creating 8 inches of space.
Unless you have a connective tissue.
Yes, and we got other things we're going to talk about. So, what do you talk about with your patients when you talk about this?
Well, I think the first thing that I always talk about is like, you know, in order to have a vaginal birth, your pelvis needs to like create space. And then I often like talk about the pelvic floor because I think for some reason people think that is the group of muscles that is like expelling or pushing.
Oh, yes.
And so I would say like really the job of those muscles is to get as much out of the way or mobilized as we possibly can during birth.
So the pelvic floor is not pushing out the baby.
Right. So it's like, you know, all of these muscles that are at the bottom of your pelvis, their job is not forcing the baby out or pushing the baby out. Their job is to literally mobilize and move out of the way as much as possible. Open.
Yeah.
So I always kind of like set that context. And then we talk about too, like, okay, what are you thinking about for pain control? Because that's going to impact mobility and like availability of positions during birth. So that's usually where I start.
Yeah. So what Eryn means is if you're looking at getting an epidural, then you're not going to have as much means of supporting your own body weight.
Right. So you're a little bit more limited in terms of your mobility during labor and birth.
But I think what happens too is that women will get an epidural and they think the only option is to birth on their back, right?
Yeah.
The beautiful thing about having like peanut balls or birthing balls now, which I think that a lot of hospitals have these items now, is that you can put your legs up onto it. So it's not a matter anymore of having to have someone hold your leg, having the staff to hold your leg. You have the option.
Yeah.
But even with an epidural, you have the choice of how your hips are. So when you rotate your hips like outwards, right? So you see it opens up the top, but it closes the bottom a little bit more, right? When you kind of open your legs and then rotate them inwards ever so slightly, so it's an inward rotation up here, but you can see what happens to the pelvic bones. So they get a little bit wider, more space. So you can play with that just by whether your knee is up or down in those positions. So you still do have choice even with an epidural.
Yeah, absolutely. And like even just like well-positioned pillows, like head pillows, right? You can use to your advantage to create a little bit more space. And you even have options if you do have to, and just because I don't want people ever like worrying, right? Is that like I'm not doing something right. Like even if you have to go onto your back because of access or the, you know, physicians or a medical team need to monitor something, there's still options if you're on your back that we can offset the pelvis a little bit and create more space, even if you are in a more flat on your back type position. Yeah. So I think I just reassure people of that too, that if things don't go exactly as we talked about or as they're planning on, there are still other options too, so that they're not, you know, worrying that they're doing something wrong.
Yeah, and this is where it comes in handy that you've gone and done some prep work beforehand.
Yeah.
Even when you come, if you come see someone for birth prep, practice it before, like even if you've seen us do it, practice it. Because if you have, you know, right hip pain when you lie on your side for too long, you want to know about that before you're also trying to push out a baby at the same time. Yeah. So I think it's important really to practice what we've done and then you're... I
make bad jokes about how if someone told me I had to squat, I would say never.
Yeah. Squatting birth.
Personally.
I know. But some of our patients love a squatting birth.
Personally, like that, if I was in pain, that would be like...
Not the position you're in. Yeah.
Don't come even close to me. Don't do
that. Eryn doesn't want to do a squatting birth, guys.
I did not.
All right. Anything else? We got 15 seconds.
No, I think that's like, ask us questions. Like we're
happy to discuss that. All right. We'll give you guys an extra 5 seconds in your life, so.
Drink coffee.
Bye.